we'll turn to Ms. Theresa Greenfield. Theresa, I guess the way we'd like to start is just to allow you to sort of set the tone with how you want us to think about healthcare, how you think about healthcare. What's your philosophy? What are your top priorities when it comes to healthcare in the United States? Where are we going? Where have we been? How have we handled the COVID-19 pandemic? Where do we need to improve? How have things gone in Iowa, just with regards to healthcare delivery, quality, payer concerns, equity, social issues, all of the above. And then from there, we'll just kind of continue talking. So thanks so much, everybody.
Can you hear me now? Awesome.
We can, thank you.
I appreciate it. Well, thanks for asking all the easy questions first, right? I'll tell you what, I think what I'll do, if you don't mind, I'll start out and tell you a little bit about me. And then Gabe, hopefully we'll get to all of those topics through the course of our conversation tonight, if you don't mind. First and foremost, I am just delighted to be here. Thank you, everyone, for coming out. Do I see that we have like 60 some people attending? Thank you, everyone.
Yes, ma'am. I know a lot of these people have exams tomorrow. There were research conferences. We're busy. You're busier than all of us, I'm sure. But thanks so much for making time to talk with us.
No, we all have busy lives, and I want to say thank you for pursuing careers in healthcare, public health, and so many other things. And I really am excited to be here tonight. I'll tell you, I think healthcare will be on the ballot tonight, just to give you the short answer, Gabe, the ballot this fall, because it has been the #1 topic that people are talking to me about, as I've done 250 of campaign events or more now around the state, and this is pre-COVID. And with COVID, it really is top of mind, as you can well imagine. A little bit about me, I'm a businesswoman. I've spent much of my career working in small businesses, whether that was running bean walking crews on the farm. Anybody know what bean walking is on the farm? Okay.
I did some detasseling. I don't know about bean walking though.
It's that kind of work where we're walking in the field. To working my way up to being the president of a commercial real estate company where we had 8 employees. It was family owned. And Iowa is a state of small towns and small businesses just like that. And I think as you head out to your practices, some of you might be working in large systems, and some of you might be working in very small practices across the state of Iowa and across this country. I'm a mom. I love being a mom. I have 4 kids. I'm a military mom at that. Really what I love best about it right now is I'm an empty nester. That is fun. My husband and I like that. And I'm a farm kid. I grew up outside of a little town of 500. I graduated and came of age during the farm crisis. And on our little farm, I call it the Greenfield farm, my dad always said, there's no boy jobs and there's no girl jobs. There's just jobs that need to get done. And that's where I learned to work hard. I learned to make things and fix things and had a real satisfaction at the end of the day for getting a job done. I think Washington needs to work a whole lot more like we do on our farms and our small towns and our communities, where we come together. We don't see problems as Democratic or Republican problems, but they're problems and they're jobs that need to get done. And I intend to take that attitude with me to Washington, D.C. So on to the pandemic, just briefly. I think that this COVID pandemic is going to be one of the most consequential events of my lifetime. Certainly it has had enormous health consequences, tragic loss of life, too many folks infected, too many people suffering from the healing after they get over the disease. There's a lot of struggling there. But it also has disrupted our economy. And so whether that is education, love to hear if you've had disruption, whether it is our supply chains, whether it is travel, whether it's just your small business. And as I travel around the state, too many small businesses tell me that their cash flow is down about 60% still, and they haven't been able to hire back workers. And so we still have really high unemployment rate here, and we need help. We need leaders in Washington that recognize that and will pass some significant aid that focuses on our workers, our small businesses, our healthcare systems, our schools. Our local governments need direct aid, and we can talk about that as much as or as little as you all want. Let's see, what else do I want to tell you? Healthcare is the #1 topic, always, always, always. And the things that I hear the most about, and I would love to hear your thoughts tonight, it's cost, premiums, deductibles, out-of-pocket expenses. It is prescription drug costs, particularly for our seniors. And then when it comes to care, it's mental health care, addiction care, it's services around the state. So you probably know labor delivery units are closing. I hear about that. That concerns me. It's the inequality and some of the racial disparity in care. So something that I'm irritated about, I will tell you, is the Black maternal mortality rate as a mother of 4. That rate is 6 times higher than any other population across the state, and that really should not be going on. So I am curious about the training you're receiving, if you think it's top notch and will help you end that kind of disparity and discrimination in healthcare. I'm going to be working on it in all our systems, though, whether it's housing or education or policing or lending or healthcare. I want to work to build, a more equitable, more inclusive systems for all of us to benefit and thrive. So anyhow, I got in this race, I have to tell you, to put Iowans first. And the other decision I made is not to accept 1 dime of corporate PAC donations. And I'm pretty proud of that decision. And it allows me to, 1, make sure that when I'm voting in the interest of Iowans, not in the interest of corporate donors. And I think it's one of those things that really sets Senator Ernst and I apart. I think she's had 6 years and she's forgotten. She's forgotten seniors who can't afford their drugs, seniors who are worried about privatizing Social Security, going behind closed doors to gut it. She has forgotten about our farmers. We've had 85 ethanol waivers that have been granted and have gutted that industry. Price of corn, about $3.30 today, and that is not a Yahoo making a lot of money price. Not at all. It might be covering input costs. I hope it does. She's absolutely forgotten about our healthcare workers and our care force. And I, for one, have been offended by her recent comments promoting a conspiracy theory that suggests you and your colleagues are not being truthful or not looking at the numbers correctly, reporting them correctly when it comes to COVID cases and deaths, and that you would be getting rich off all of this. That's irresponsible. It's wrong. And in no way should we be undermining the integrity and the trust that we have with our healthcare workers, because you guys are there every day fighting for the sickest of us, the most vulnerable of us, and I appreciate your work. So with that, thank you for letting me be here. I am really looking forward to questions, comments, learning, listening, so that I can lead when I'm your next senator.
Thank you very much for all that.
Yeah.
And I think we certainly, I think I speak for everyone, and we really appreciate those comments specifically about, Senator Ernst did make some comments that caught most of us in the medical community off guard, just to put that mildly. So we appreciate that. We, most physicians that I know, you mentioned cash flows being down. That holds true for hospitals and physician practices as well. So those comments did catch all of us off guard. But I'll set the tone.
One other comment?
Sure.
I really appreciate all of you letting me come here tonight too, because if you did any bio research, you know that I went to Iowa State. And I hope you won't hold that against me as you deliberate and make your voting decision. But I wanted to toss out that one of my sons did go to Iowa for his double MBA in public health and I believe health administration. So I've got a little bit of Hawkeye blood kind of in the family.
We love that. And so a couple tie-ins there. One, I tried watching the Iowa State game a week ago, and I'm sorry about that loss. That must have been tough. But what I noticed is I probably spent just as much time watching football as I did watching advertisements between Joni Ernst and yourself just for the campaign. And one ad that stuck out to me with regards to the race that was tied in with healthcare is that Senator Ernst makes claims that your policies would close down critical access hospitals. And before I turn over to our other questioners, I would like to maybe see what you think about, I'm sure you've seen that advertisement where she claims that with you sort of in the Senate doing what you want to do or achieving what you want to do legislatively, critical access hospitals would close down as a result. I'd like to know what you think about that. And if you do, I assume you've seen it, but I don't know.
Well, I got a couple things to say about that. That is hooey. And if you grew up in the farm, you know who he is. I absolutely know that our hospitals are struggling right now in COVID, absolutely. And when it comes to healthcare, I think it's a right. And I want to work hard to strengthen the Affordable Care Act, enhance the Affordable Care Act, build in that public option to make sure absolutely everybody has care and access. I want to make sure that Medicare can negotiate for those prescription drug costs, using the leverage of the largest group, Medicare users, to bring down those costs. And it's estimated could save us about $500 billion. And at no point in any of this would this impact critical hospitals. Senator Ernst, on the other hand, she's voted repeatedly to end the Affordable Care Act, which would end Medicaid expansion. And Medicaid expansion has been something that's been a lifeline for hospitals. And when you compare states across this country that took advantage of Medicaid and those that didn't, you'll see a stark difference in the hospitals that have closed. And so her votes actually would impact rural hospitals in particular, who have, a larger population of older clientele. And so her votes absolutely could close hospitals across the state.
Thank you very much. And with that, I'll turn it over to Eric Anderson and Krekor Bernazian, and they were my intel guys, our organization sort of research and intel guys, doing some deep dives to find some questions that maybe haven't been asked before, or that are particularly important to medical trainees as we think about the delivery of care. So take it away, guys. Thank you.
Thank you very much, Gabe. Ms. Greenfield, I just want to repeat the sentiments said by Gabe and whoever else actually introduced you. Thank you so much from our organization and the audience that is present today for joining us. This is a very big, important meeting in a crucial time, especially during the fall coming with the election coming up. So thank you so much. So I'm gonna, I have a few questions listed here. These are open-ended questions which are meant to kind of give you an opportunity to go into more detail on some of the policy decisions that you have stated in the past. And with that, I'll just get right into it. So you did mention we're living through an unprecedented time with COVID-19. This has had a tremendous impact on families and communities across the nation. And it's also a big burden on healthcare systems today, especially as like up and coming physicians. This is something that we might have to deal with in the near future. So in your opinion, what has Iowa done well with the COVID crisis, and what has the state done poorly, and how can we improve?
Okay. Krekor, is that your name?
Yes, Krekor.
Krekor, okay, thank you. I'm sorry I didn't hear it the first time, and I wanted to just make sure that I got it correct. Thanks for that question. Yeah, I mean, I think that you're absolutely right. We always want to step back and think about what we've done well and where we can improve. And so I think that one of the things I've seen done well has been that people have gotten together to solve problems in their communities, whether it's been county board members, working with mayors, working with city council members, working with small businesses to really try to solve the problems, try to gather the resources that they need, try to get people the help that they need. I think what we've done poorly is we've just had, we haven't had strong leadership from the top, all the way in Washington to the state of Iowa, where there's been really mixed messages about what the public health guidelines are and how we follow them. And I do know, of course, that as time goes on, we learn more about this virus. And so we're able to do better. That's what you would expect, and I hope we do. But it's clear, for example, that the White House task force recommends Iowa have a mask mandate, and yet we don't have one. And I think that's something we've done poorly. Does that mean that I expect we'll put people in jail if they don't wear a mask? Of course not. But it means that we set a real clear bar and an expectation and how important it is that every Iowan wear a mask and that they social distance, and that we are trusting the science and our public health experts as a way to mitigate and a way to stay healthy. I have seen businesses come together, and I'll have to tell you, when this pandemic hit, certainly it hit hard in our meatpacking industry. And a couple of weeks ago, I got the chance to tour a meatpacking plant, and I toured both with the leaders from the workers' union and the leaders from the plant. And they have come together to really understand how they can modify the workplace and keep their workers safe and keep operating. And they've done this without very little guidance, not enough, that's for sure. And today, the plant that I visited told me that they had, I think they had maybe 3 cases over the last 2 weeks. And the workers were happy and satisfied, and the company was too. And they had to come to that alone without the support of the federal government setting emergency standards. And I think we could use those emergency standards for every single industry. So that's something we've done poorly, but easily could do well. So I hope I've addressed a few items, and I'd be curious about what you guys think has been well done, what we've done poor at, what you would like us to take away from this if I'm your next senator.
Well, I'll just say I'm one person, but I love the idea of someone that is willing to work on both sides of the aisle. That sounds to me to be a great reprieve from what we've seen over the last few decades. It seems Congress, I think if you look at survey data, sometimes you'll see that Congress is disliked more than rats are, and things like crazy stats that just show the American people have contempt for Congress because it's so partisan, and it has been for so long. So just on account of what you're saying, you want to bring your lunch pail to work with both sides of the aisle to actually do things for the American people. I think I certainly love the sounds of that. I'm just one person. Crecor and Eric, go ahead.
Now let me play a little bit more. I don't know. I don't think I mentioned this early on, but when I was just 24, I was widowed. My first husband was a lineman for the power company. He was a union member, and he died in a workplace accident. And I was left a single mom at 24 with a 13-month-old and another one on the way, and really no way to pay the rent. And it was Social Security system, it was union benefits, family, friend, neighborhoods, that lifted me up and got me back on the track. And I was able to go back to college, and I studied community planning, city planning, and worked for about 14 years providing for the boys and I in that field. And what that meant is I spent 3 nights a week at neighborhood groups, planning commissions, city councils, town boards. And you learn really quickly that a pothole in the street is not a Republican problem, and it's not a Democratic problem. It's a problem that needs to be solved. And the only problems we ever solved that had real teeth and problems that we solved that really built a brighter future for our communities were the problems where we brought all the stakeholders together. And we asked people to sit at the table and work hard to find some common ground. And it works. Our cities have to do that. Our mayors, I have been calling mayors around the state. I don't care what their voter registration is. I could care less. Mayors have to lead for all the people all the time. And I was reaching out to understand just how we could work together in the federal government, the needs, how COVID was going, the derecho, et cetera. But it was echoed time and time again, regardless of the party of that mayor, that they have to work together to solve those problems. And so that is ingrained in me from my first 14 years of my career.
Thank you very much. Eric or Crecor?
So one of my main concerns ever since the COVID pandemic started is just the skepticism and so many people within our communities regards to the science behind it. And this is partly because of how so much of what we know about the virus, as you said, Ms. Greenfield, of course, we're evolving our understanding of this virus. And it's somehow being mistranslated into a skepticism within the community. And one of my main concerns and kind of hopes within leadership, especially in the federal government, is to have a unified voice towards a certain direction that the country should be taking. And I guess this is just a comment. We're not there yet, and I just would like to see more of a unified voice from the very top. And from what you have actually discussed, you hope so as well, and that like we're very grateful for that.
Yeah, Cree-Corps, I hope so too. I really do, and that's the work ethic I'm going to take with me as your next senator.
Thank you.
Yeah, thank you.
Ms. Greenfield, this is Bill. If you Google close Senate races, you'll see Greenfield and Ernst is a toss-up. This is a critical race. What do you think would be what's your biggest obstacle to winning? Beyond, I mean, funding. It seems like from what I've read, it looks like money doesn't seem to be a primary issue for you. It sounds to me like you've outraised your opponent. What would be your biggest obstacles? Is it the fact that Senator Ernst is an incumbent, or what do you think is a relative weakness that you might have compared to the incumbent?
Great question. Well, I'm here to tell you this is a race we can win. Absolutely can win it. And I have been and will continue to take, every bit of my scrappy farm girl and my grit and resolve all around the state. Some of it traveling in person and a lot of it meeting in Zoom, because we have found Zoom has really given us some opportunities to connect in ways we can't when we drive just to one town. So that hybrid of campaigning has been wonderful for us. Here's what I think. I think Iowans are a bunch of independent thinkers, and they're a bunch of independent voters. And they have shown that for years and years and years. And if you're familiar with Iowa politics, you'll know that Iowans elected Democratic Senator Tom Harkin, and they reelected him for 30 years. And at the same time, they elected Republican Senator Chuck Grassley, and he is still serving in the United States Senate. And people voted for both of them because they're independent thinkers and they're independent voters out there. And so I have tried and worked hard to go out there and ask for everyone's vote. And I think right now, we're going to continue to ask for that vote, but I think there's 47 days until Election Day. I think there's 18 days until early voting starts on October 5th. And so we're certainly moving into get out the vote efforts and making sure that everyone understands how to register to vote. Everyone who is registered is making a plan to vote, whether that is requesting your absentee ballot form, and filling out that form and receiving your ballot and determining how you're going to return it by mail. You're going to drop it off at the county auditors or however you're able to do that, or whether you're going to vote in person. And certainly I think there'll be plenty of opportunity to do that in a safe way, because early voting starts October 5th. And so you can, right now, I don't know what day you don't have classes, but I bet there's a day that you could put on your calendar right now and make an appointment and go down and vote. But most important, getting that vote out is absolutely what we're focused on now as we move into this home stretch to November 3rd.
Sadly, physicians don't have a great voting record. I'm not sure. We're busy people, physicians and physicians in training. They don't vote that much. And that's one thing I'm trying to address just with our cohort of medical students, because we need to vote, right? And I think America sees that there's a fork in the road coming on November 3rd. Whatever side you're on, there's a fork in the road coming, and you got to be a part of that decision. Otherwise these decisions will be made without you. Ms. Greenfield, I want to get to a couple of our questions from the audience. First one's Caleb Eel. He asks, what are some ideas that the other side of the aisle, traditionally has that you'd be willing to work with them on? You say, it sounds like you want to be a maverick, someone who's willing to work with both sides. Are there any issues in particular that you think perhaps the Democrats historically aren't completely right on, that you would work with the Republicans, collaborate with the Republican Party to address? Besides everything.
And did you say Caleb?
Caleb, yes.
Oh, there is. Hi, Caleb. Regulations. I got to tell you, when I spent 14 years as a city planner, when we would get too much red tape involved in getting a project done, it's frustrating for everyday citizens. It's frustrating for business. And my attitude is we need to take a look at our regulations, and we need to keep what's working, because there's nothing more important than protecting our public health, our public safety and our general welfare. But as part of doing that, if we can cut some red tape, and we should do that. Again, whether it's talking to mayors around the state, I'll tell you, they want to make sure that we make these processes more efficient so they can serve their communities better. And then if you don't mind, if I just give another kick, I'd say this, something I've been disappointed in both parties on is the lack of a robust infrastructure plan. I know that we were promised a big, beautiful $1 trillion infrastructure plan. Well, right here in Iowa, and this is a sexy fact, Iowa is 50th in the nation in bridge suitability. We got a whole bunch of bridges that are in bad shape. And again, those bridges aren't Republican or Democratic. They're bridges that we all use and need to get safely from home to work, to have our first responders get from town to our farms, to get our grain to market, and so many other things. But it's not just that. We talk about wanting to be the best in the world and to compete and win. Well, I'll tell you, we have too many people that don't have access to broadband internet. So from bridges to broadband internet and everything in between, I'm going to be working hard to get a robust infrastructure plan and make sure we're making that investment for generations to come.
Awesome.
No, I would
Thank you,
love it if
Theresa.
Iowa got back to its sort of maverick status, having a Harkin, Grassley sort of divide. I think you're right. Iowa has unique thinkers. We don't need to be siding with one group because beliefs should evolve. We'll go to Daniel now for a question.
Hi, Ms. Greenfield. I was curious, so, with the current pandemic, one thing that has kind of come to my mind a lot, and I've thought about this problem a lot, is the issue of coverage for healthcare, especially since, I guess the idea of expanding Obamacare, I really like that idea, except Obamacare, what it was kind of notorious for was it caught a lot of people in this like gap where you had, okay, you didn't make enough money to like get on the Obamacare plan, but you also made too little that if you were forced to pay it because you'd otherwise be penalized by it, you'd be kind of out of luck either way. And I think, especially in the midst of right now, what Obamacare did is it expanded access for, I'm sorry, this is a bit of a big question, employees to have it, but a lot of employees are now losing their health care because they don't have any jobs anymore. There's a lot of connection to insurance and jobs. And so I guess my foregone conclusion is that, it doesn't, I'm still unsure why you don't support Medicare for all, especially since like 40% of caucus goers in February supported it. And I think right now also you have a lot of other nations. I mean, Italy got hit really hard by Medicare or by the pandemic, but what was notable about it is that they basically all said, oh yeah, our united healthcare system is kind of what kept it from falling apart. And right now we have this fractured Medicare system or healthcare system that with the private data plans or, Epic or these other systems, you can't communicate between people. The drugs cost too much. Pardon my French, with the coronavirus vaccine, one thing that's going on, it's funded a lot by public funds, but it's going to be charged privately. So all this kind of comes back to why not just make it easier, have our taxes go for just improving our healthcare and just paying for it at cost and not having a profit motive attached to it. Why not just do Medicare for all?
Yeah. Daniel, thank you so much. Absolutely. And I'll tell you, I think that there's a big difference between the Democratic Party and the Republican Party because we want healthcare for everyone. We think it's a right. We might have different solutions on how to get there, but we want to fight for that and make sure that everyone gets care and coverage that they need. And for me, I just happen to believe that the way to do that is to strengthen the Affordable Care Act, to take a look at it, keep what's working. We've learned a lot about some of the things that didn't work, but some things that really did work are those protections for essential services. I think that I certainly have talked to some of my friends and neighbors who, man, they hated that Obamacare until they found out they had a pre-existing condition. And we've learned an awful lot. And I think that given the chance to strengthen it, we'll bring the best and the brightest minds many of you maybe, hopefully, to the table to see how we can do that. And then I do believe we need a public option, and that certainly will create competition. And I'd like to think that if we can create that competition, we can make a much more equitable marketplace. And to your point, COVID has again shown and laid bare a lot of the inequities in our healthcare system, where if you're reliant on employer-based healthcare, you don't have it right now. And certainly Senator Joni Ernst isn't out there fighting to open up the exchanges to make sure that you can get healthcare or qualify for some type of healthcare coverage. And so that's where I want to start. And I think that that is the place I'm certainly going to the table. But I do believe that we will be the party of healthcare, and they're the party of, I don't know, take Clorox, I guess. I don't know.
All right, thank you.
Bradley, did you want to ask your question?
Yeah, it's a little out of order now, but I was just wondering on the kind of question about bipartisan issues. If you were to be elected as a senator of Iowa, would you support Grassley's Prescription Drug and Pricing Reduction Act of 2020? And if so, or if not, why?
Yep. Bradley, thank you very much. Thanks for coming out tonight. We've got to lower prescription drug prices. I would support Senator Grassley's law, absolutely, or his bill. I absolutely think the first thing we need to do, and I've said it before tonight, is make sure that Medicare is negotiating to bring down those costs for our seniors, for all of us, put some caps on prescription costs. I think that if you can import and get safe and comparable prescriptions from a pharmacy in Canada, you ought to be able to do that. And so there are a number of things there that I absolutely do support. Consumers need those prices to come down. And Senator Ernst had 6 years to get that job done. And I'm hoping that we take back the majority of the United States Senate. And that's one of the things that we get done.
Thank you, Ms. Greenfield. I'm kind of curious, can you kind of tell us about when you became motivated to run for a congressional office? When did you realize, this is curiosity, when did you realize, you know what, I'm made of the stuff that lead my country? And what led you to actually running for office and going through this? This isn't, what you're doing is not easy. I mean, it's a lot of things, but it's not easy. So I'd love to hear kind of your motivation. What keeps you going every day?
Well, Gabe, thank you for asking that. You know, I've had a lot of great experiences in my life. I've had some ups, I've had some downs. I've had to rely on a number of our systems, be it public school or the Social Security system. I've relied on unions and neighbors and friends and family. I've had to bring a lot of elbow grease to my life to get where I'm at. I love leading. Again, I think that showing up to listen, to learn, makes me the very best leader. But I've been running small businesses, and I'll tell you, sometimes you have to make tough decisions there too. I know how hard it is to keep the lights on and meet payroll. And I've always had a lot of pride when it comes to providing jobs. I mean, my employees have always become like family to me. But I tell you, I grew up marching in parades. My mother took me to county party meetings. We didn't do phone calling because we had a party line, if anybody knows what that is. There were no cell phones. We didn't text, but we wrote letters and we knocked doors. And so I got a real grassroots experience there and got to meet candidates, you know, people that were our House of Representative, elected House of Representative members. So I've always had a passion for it, and on and off have been involved. But I'll tell you, over the last few years, and certainly with 2016, like women around the country, I decided I was going to stand up and lead. I was going to come off the sidelines from being the president. I was going to take my experiences, my compassion, my wits, and run for federal office. And I chose federal office because I am passionate about Social Security. And it really drives me on a personal level to run and to sustain it. Senator Ernst talks about privatizing Social Security. She's talked about gutting it behind closed doors. She's been supporting a payroll tax right now cut, which would defund Social Security, and even Senator Chuck Grassley has thrown cold water on that and says it's not a good idea. But I will tell you, for all of you, I hope that you all get involved and that you do run for something. And not that you are asking for my advice, but you get it. And that is run for something you're passionate about. I don't care if it's dog catcher. I don't care if it's President of the United States. When you are passionate about it, you'll be successful and you'll be a good leader. And I suspect that's why you're studying the various healthcare fields that you're studying right now, because you have a real passion. And it is no different. And so I am thrilled to have made this decision to get off the sidelines and get in this race. And I couldn't be more excited that it is a toss-up, that we have built a strong grassroots team, because I have done that all over the state. And we're going to continue to motivate and activate that team to get out and vote starting on October 5th and wrapping it up till the polls close on the 3rd, all in an effort to flip this seat and give Iowans someone who's going to put them first.
Thank you for that. I think a lot of us, feel like, hey, I'd just like to vote tomorrow if I can. Do we have to wait another 47 days? It's been a hard year, and politics are hard, and it's been brutal. So anyways, thanks. Chris.
Early voting, I think, starts October 5th. That's like 18 days. So there, mark the calendars. Less than 3 weeks.
Chris, do you want to read your question or ask your question? Otherwise, I can go ahead and do it. Give you a few seconds here to.
Yeah, sorry about that. I was muted. Yeah, I can go over it quick. It's a little wordy, but
so in essence, tweet it at her.
Okay. Over the last 20 years, Iowa has seen a drastic increase in suicides. It's up more than 35% since 1999. And this is worst amongst middle-aged men, especially those living in rural areas. So right now, more middle-aged white Americans are dying premature deaths than at any point in the last 50 years, mostly due to overdose and suicides. Additionally, to exacerbate this, 86 of Iowa's 99 counties currently do not have adequate access to mental health care. And so what initiatives would you have to reform and invest in our nation's mental health infrastructure, especially in rural areas?
Oh, Chris, you are hitting on a topic that truly people have shared the most horrific stories and heartfelt stories and the pain that they have felt. Losing loved ones to suicide, whether it's from mental illness or whether it's through addiction, whether it's through stress and despair. Certainly farmers, and I don't know about all of you, but I know certainly this is something that's been touched within our family and in my neighborhood, and then I think everybody understands that. And we have woefully inadequate resources here. And it's been going on for some time, but certainly started a few years back when the governor, Branstad, closed 2 of our mental health hospitals, and those patients that were being served, or those resources where someone could get care, get critical care, urgent care when they're in a crisis. Unfortunately, I think those folks are still getting care, but it's happening in our jails and as part of our criminal justice system. And that has not been successful. Just recently, I had a mental health care roundtable with leaders from all over the state. A number of NAMI members were on board. And just last night, we also participated in a forum with ARC of Story County and NAMI, just hearing about what they need. So what do they need? Well, we need you. We need to find ways to make sure that we can attract more psychiatrists, psychologists, physicians that are interested in mental health care, addiction, as part of the holistic healthcare approach. We need to find ways to make sure that you come to Iowa and that you stay. And I hope you all know that Health and Human Services does have a rural loan forgiveness program. I absolutely want to make sure that we are growing it, investing in it, and making sure that it is operating efficiently, because it's not just Iowa that has these kinds of issues. And then next, I really would like to step back and make sure that we are looking at holistic care. Sometimes I think we focus on sick care, as a way of healthcare, but looking at all those social determinants to health, workplace, family relationships, mental health, physical issues. Hey, do you have an air conditioner? I mean, are you living in too high of heat? So many things. All of that tapestry of health being woven together in a community to understand how we take the best care of one another. And I think if people were getting that care, healthy food, healthy living environments, mental health care, school situations, so many more, we would be able to tackle the mental health care crisis that we have.
Thank you, Ms. Greenfield. Just to clarify, how much time do you have left with us? Your time is valuable. We don't want to overindulge. So how much time would you say we have left with you, Ms. Greenfield?
I have 3 minutes.
3 minutes. Gotcha.
I apologize.
No worries at all. One issue that is close to my heart, because one question, yeah. One issue that's close to my heart is the geographical price cost index that Medicare uses to pay physicians. Are you familiar with this?
No.
So, long story short,
name, but go ahead.
Gypsy. Physicians in Iowa are disproportionately affected by Medicare payments. We don't, and that it's a big part of why Iowa has a horrific shortage of physicians. And it's, a lot of times you can talk about healthcare generally, and we all want outcomes to get better. But in Iowa, one easy fix is to recognize the fact that healthcare costs don't change from region to region. It's all, medical equipment comes from one supplier, and prices, if I'm in Ames, Iowa, or I'd be in Iowa City because I'm a Hawkeye. If I'm in Iowa City, I'm buying my MRIs from the same place that San Francisco doctors are. But Medicare is going to pay those San Francisco doctors more than they're going to pay me in rural Iowa. And that's a big part of why physicians don't want to work here. And it probably leads into why mental health outcomes and just rural health outcomes in general are so poor. I think in Iowa, physicians would love you if you were elected and you were able to do a gypsy fix to fix the way Medicare pays physicians in Iowa.
Yes. Gabe, yeah, this does come up. I apologize when you first mentioned it. You talk faster than I do. But that's different from being a fast talker. Let's just be clear. But I absolutely, this is something that has been brought up over and over again from mental health care providers, from folks who need the services, from healthcare physicians like yourself. And we do need to take a look at it. And I think for me, it gets back to that. We got to look at what works and what's broken and make sure that's equitable and get the care we need here. And that folks are being reimbursed in a way that encourages them to provide their services right here in Iowa. So you have my my commitment to really try to work on that.
Thank you. There were other questions, but you're a busy lady. I think from the bottom of our hearts, thank you so much for spending some time with us. It means a great deal to me, and it means a great deal to, I think, the 55 people still here, and I think to the 60 people that were here, those extra 5 people, I think they cared too. So thank you so much.
Yeah, and Gabe, I would encourage you to, you can gather up questions. We always ask folks to send them on to my team. I'm not sure who you worked with, Izzy
sure.
or Dahlia for the event, but send those on and we'll work hard to try to get you some responses and continue the dialogue a little bit. So I'm just going to say thank you for coming out tonight. Thank you for letting me spend an hour with you. I hope that every one of you makes a plan to vote because your vote is your voice. And with that, I'm just going to say thank you. It's been a pleasure. I look forward to meeting you in person soon, and look forward to meeting you with your white coats on across the state of Iowa.
Absolutely. Thank you so much. May the best candidate win. Truly. That's what we want as Iowans. We want the best candidate. We want the best leader of our state. So hopefully, if that's you, then I hope you win. All right.
All right. Thank you very much, everyone. Have a wonderful evening. Bye-bye.